So regarding death rates, those death rates are for China. Same here in terms of fatality rate, depending on comorbidities. So in terms of death, you're supposed to sum up all the different risks for severity and death. So I have twice the risk of someone that is less than 40, etc. So the point here is that we we need to be aware that this virus would spread without even us noticing. So two things. Severity has been changing from the initial cases in Wuhan, where everyone was locking down and are still locking down in their houses, to now in United States and the rest of the countries, Europe, etc. So why is that? What is being so far being shared is that the higher the vital load that you get at the very beginning, and the repeated exposure to the virus apparently could make your body or could overrun your body's immune system. So we're starting to see young people in critical care. We're starting to see uh, health professionals in less than 20%, around almost 20% of health professionals are being getting sick, and that was unexpected from the statistics from China. So the recommendation right now is to know that this is a virus that goes airborne. It's a virus that is being transmitted, according to the World Health Organization last week. It's been transmitted through air. That was something that was suspected, but it's already confirmed. And you're getting people that are working in the same call center. And for example, that happened in Korea. They were following all recommendations of social distancing, at least 6 feet from each other, not touching anyone. However, the whole call center tested positive. So in this case, what you're getting is people that are having no symptoms, but the virus, the spike of virus in the blood goes up so fast in the second day that when you're starting to get symptoms in average at the fifth day, you already went through the phase of transmitting the virus quickly from day 2 to day 5. And that's the issue, that even if we are buying things out in doing grocery shopping, it could be a huge issue, because that person, even unintentionally, could infect, if we don't do not anything, in average, in 5 days, could infect 2.5 people. So if we keep tracking those people, the experience is that if a country doesn't do anything, that person is going to infect in 30 days, within a month, 400 people. It's very infective. It's just the regular, it's un catarro. It's just the that's why we call little children mocosos, because they're already having a lot of viruses. They have coronavirus. We have coronavirus every single year of our lives, pretty much, because it's one of the most common ones. So what happens if we start isolating ourselves, like safe isolations, like Abarca is doing, and many people are doing currently? So we decrease the amount of people that would be infected within 5 days, and eventually, just by this small decrease, by decreasing it by half, you get 15 people only within a month. And this is pretty much where Puerto Rico is. So we're in good shape after we started it. After we started this, however, maybe we took too long to start. So at this point, the growth rate, and you're gonna see it, the growth rate in Puerto Rico of cases, it's closer to United States growth rates in terms of confirmed cases than the growth rate of China, Taiwan, Singapore, and other countries that started early to take measures. So we have here, if we only allow like health professionals, the police, like really people that are that really need to be in the street, then it's reduced drastically within a month. So this animation shows what is the issue here? Why even young people? Why we need to take measures to isolate ourselves? It's just that eventually, if we go slowly with cases, the expectation currently in Puerto Rico is that most of the population is going to be infected at some point within this year. However, what we need is for most of us to stay out of being infected, and even more people that have a high risk of severity, because we want to wait until we have something to treat this. We're already, at the end, I'm gonna show you what, just a hint of what have been found in terms of treatment. Antimalarials like hydroxychloroquine, with antibiotics like azithromycin. There are drugs in the pipeline from different companies that are working hard to get both a vaccine and a treatment for this. So we need something that is effective and is proven safe, and that is accessible. Right now, if you call any pharmacy, it would be really hard to find some hydroxychloroquine or zinc at this point. And that's not only in Puerto Rico. Even Sanofi, that makes the brand version back in France, they're struggling to get enough to treat everyone. So France is having this issue. So this is what we have been seeing in Spain. Why Spain has already more cases than, I'm gonna come back to this table, but I want to show you, I just want to show you just a hint. So China started back in November having cases. So those first months are really important, because at the very beginning, what you're seeing is
I said this right because that was out of the top of my head. Those aren't the numbers, just so you know.
What was the question?
Was that Osvaldo?
Okay, so Osvaldo, I'm gonna continue, and at the end, please, I can get back to this slide if necessary. So what we're seeing here, this is updated up to March 23. I should change that. That's up to today. So you could see China growing, but they have millions of people. Now Italy is having such an exponential growth, and if you see United States, the growth, it's actually at this point, because they started to have some lockdowns in Italy. The growth of United States, it's actually going to, if nothing else is being done, is going to continue multiplying every 2 days. What we're seeing is that this is ordered by the country that is growing their cases more exponentially to the one that is less exponentially in America. Okay, so what we're seeing is that it's not that important the amount of cases. If Puerto Rico we have less cases or more cases, currently we have more than 21. The last number, I believe we have 5. I don't know. I have to check how many we have now, but we already have 2 deaths. I do know that. So as of today, so this was yesterday. And what you're seeing here is that every day, Ecuador is increasing the amount of confirmed cases twice. It's doubling the amount of cases, confirmed ones. And Puerto Rico, every 2 days, we have 3 times at least more cases, etc. In the case of United States, they're doubling their numbers every 2 days. So that's really dangerous, because once, let's take, for example, what's going on in New York. I'm gonna show statistics from New York. Once you start having too many cases at once, then as we saw in the in the graphs, the amount of people that goes beyond what our health system could support coming to ER, coming to the hospital is higher than what we can support. The death rate should be for coronavirus worldwide the same death rate as in Singapore. In Singapore, the death rate is close to 0%, and the reason is that everyone is on lockdown for so much time that cases are still going, people are still being infected. But if you take 20%, those that really need to be hospitalized, those that really need to be in intensive care unit, you take 20% of all people, of the 40 something that are already infected in Singapore confirmed cases, their health system could manage that, 10 people or more in ICU, in addition to those that already use it, the different facilities. However, if out of the blue, we start having 20% of a huge number of people, what's going on in Italy is that at this point, last week, they had an order in the hospital not to admit people that are over 80 years old because they want to prioritize the different resources. And sadly, in the northern Italy area, yesterday there was a report that the hospital at this point had orders to deny services to everyone, at least ICU services, intensive care unit services, to everyone that is beyond 60 years old. So that's why we're seeing such a huge spike in deaths, because if any of us have a severe case of coronavirus, we're going to have a pneumonia, and fluid from our body is going to fill the areas where there's supposed to be air. So our lungs are going to start getting filled, and the person feels like it's drowning in his own or her own body. So people would die if they're severe. And what's happening is that if the system is so burdened that there's not enough room to admit more people, then instead of having what is supposed to be, that to be in the intensive care unit, at least 10% of all cases are in that situation, and be there for many days, then we'll be out to the house. But at this point, each case that is in intensive care unit usually needs intubation, needs to mechanical ventilation, and once you are there, you're gonna need more than 2 weeks to get out of the tube. So those that make it probably are coming back home, but if there's no space, then that's the issue. So in New York, there has been the governor has been asking for more beds because they are reaching the capacity of the 600 ICU and isolation units they have in New York. However, if the rate keeps, nothing else is done, if the rate keeps at the same pace, the growth rate, probably even if they build a hospital really fast, like for 1,000 people or more, 600 times 2, anyway, they're gonna fill it up next week. Again, the new hospital. So that's the issue. That is, it's not so much the people that are healthy, it's more the people that 20% that is not. And if one of us, such as a health professional, a pharmacist, is being exposed repeatedly, again and again, to someone that has the virus, eventually the viral load is so big in the body that it overruns our defenses. So that's the hypothesis why we're starting to see health professionals being severe and to see young people being severe. So our growth rate at this point, in terms of confirmed cases, is starting to look similar to other countries that have take a long time to start. And we are in the moment to take drastic measures, because once you make an aggressive move towards lockdown, towards people staying home, then it would take a week and a half for the growth rate to start dropping slowly. And that's what we have seen in South Korea and other countries that have started early. Okay, so let me go here to the questions. Here, this is from yesterday regarding the different countries. As you see, New York is having a 1% death rate. What is interesting is that if you go to if you see the death rates in the different countries, they differ a lot. So death rate by coronavirus pretty much represents how much the health system have been able to absorb that person that needs hospitalization, antibiotics, and fluids. Antibiotics because there are secondary infections. Okay, so let me answer some questions that I got before starting.
I have some questions.
Go ahead.
Here. I can go through the ones that I
Yeah, go
grabbed
ahead.
from the chat, and then we
Go
can
ahead.
go back to the ones that we had originally.
Okay.
So one question, and I'm just gonna read the whole thing. Is there an estimated communicability rate percentage of people who will contract after exposure?
Yes.
And does that change? And does that change based on whether the infected person they're exposed to is an incubation versus active infection?
Yes. So here we're seeing, actually, let me make it more easier to see. So let me put an animation here so you guys can see it. Let me show it. Let's see. Okay, so hopefully this animation is gonna work, because I took it out because it wasn't working, but it's helpful for us to see it because, let me see. Okay, so what we're seeing here are different scenarios. We can talk about communication in more detail, but in general, this is a scenario, libre movilidad, where everyone is moving. This comes from a doctor from Manatee Doctor's Hospital. Actually, it comes from the best article I've seen from Washington Post explaining in a visual way the way this communicates. So you're seeing 4 different scenarios. Let's say that in the first case, people are just having the virus, and see the blue dots are those that are people that are healthy quickly, since the spread is so fast that someone in 5 days would spread it to 2.5 people, 3 people in 5 days. By a month, you have so many cases that everyone's gonna get it. However, if you isolate people at night, let's say, for example, and then some of the few during the day go out, eventually everyone's gonna get it, but the spike of cases that you got at the other scenario would smooth. That's flatten the curve movement. Now, this is more similar to what Puerto Rico is trying to do right now, where you get blue people, the healthy people, stayed at home, and some people are going out and trying to make a normal life a little bit and then coming back. But what would be ideal is for only a fraction of people to be outside, and for the blue people to stay healthy until we get something to treat this or to vaccine against it. And look at the amount of cases, the difference in terms of infection rate and growth rate is great. So this is what we don't want, because if our health system cannot deal with many people at once at this point, let me tell you what the physicians are saying. In Puerto Rico, at least, if you read El Nuevo Dia from today, it says that we're reaching capacity because we have 70 infectologists and around that number in terms of pneumologists, and many physicians are already been out. And the CDC at this point is evaluating whether to allow sick physicians to treat people. So, I mean, sick physicians in terms of infected physicians. However, they are symptom-free. Why? Because in other countries, what we've seen is that the workforce, the health workforce, has been overburned because physicians that are being infected, they're staying home, even though they don't have any symptoms. And the best physicians, the ones in ICU, are the ones, and nurses and respiratory therapists, they're being infected and they're staying home. And then less people are trying to double shifts. And in the past 3 weeks, if you see the different communications from Italy, they've been trying to be sleep deprived and trying to do all this burden. And at this point, they are without masks, without equipment, without enough materials and personnel to treat all these people. Plus, they're getting sick anyway. So
David,
going back,
is there a difference based on whether the infected person were exposed, if that person is in incubation or active infection? Is there a difference in how quickly it'll spread, or if the person gets...
got it. No, it's going to be the same one. Why? Because the virus would go up. Actually, the super spreaders are these people that infect a lot of people at once, and most of the super spreaders, they don't know they have the disease. They have no idea because they don't feel anything different. So the ones that have the huge spikes, in most cases, they have very mild symptoms. And that's why they are super spreaders, because...
There was another question. So the virus is airborne. Is that the right terminology?
Yes, that's right. So it's airborne, and it could be infected like flu through surfaces too. So recommendations would be, what is really dangerous is mostly when you're in a closed space with air conditioning and close to someone else that has the virus, because that person, just by breathing, could be infected. It's like having a cloud of virus in our breath around us. So if you're going to buy something, you need to go out for any reason, try to first order online and pick it up if possible, or if you have the service to bring home, that would be much better. If you have to do grocery shopping, try again to order online and pick up from Econo, from Supermax. They have these apps that you can try, because otherwise we would be too close to other people that are infected, and eventually we can bring it home. If you're coming from some errand that you need to do that is really important, most of us should stay home, not go out. But for some reason you need to go out, then keep the shoes outside, your shoes. The virus survives in the surfaces for 8 hours, in, for example, the sidewalk, on clothes too, for 8 hours. And have your strategy to, once you're gonna get into the house, go straight to take a shower and have a separate place to put your clothes, the ones that you were taking out, so you can wash your clothes separately afterwards. You can touch stuff that you get from the mail. Go ahead.
Want to go through the next
Okay,
question?
yeah. Sure.
Are the first symptoms the same with every person, or do they vary?
They vary. We have seen much more diarrhea and gastric symptoms in the United States and than in China, for example. In China, people with nausea and vomiting was small, and now we're seeing more. Typically, what you're gonna see is for just having about a week of flu symptoms. They could be very mild, but at the end there are flu symptoms like sore throat, etc. muscle pain, and a little bit of stuffy nose. So you're not getting so much mucus as with other viruses. And then you're gonna, in average, you're gonna feel fine for 2 days, followed by a dry cough. So that dry cough, most people stop there and that's it. But for those that are severe, on that second week, they start feeling shortness of breath. And if for any reason, any of us feel shortness of breath, that's the moment to call the physician. You can call Teleconsulta MD from Triple S, and check out if you need to go to the hospital. If you're feeling a lot that you're not breathing well, you should go to the hospital. When you should go to the hospital? When what you're feeling and your symptoms, you're going having something, a fracture, non-related, for other conditions. When your symptoms and presentation would be worse if you stay home than if you go. Because if you go, probably you may get infected. At this point in Puerto Rico, the places where more people are being infected continuously are hospitals, clinics, and then it's sad, but the grocery shoppers in the supermarkets.
I have another question, David. Oh,
I have a question too. The people that are suffering from nausea and vomiting they are giving, are they giving or having hydroxychloroquine? Because that's a mild symptom when you use that anti-malaria drug. So I don't know if that symptom that they have in vomiting and diarrhea is part of the treatment that they having right now. Because right now, that's the promising treatment for the virus. So I want to know is
well, I would say no. I would say no. Most people that are having symptoms in United States, Puerto Rico, even in Europe, and are having diarrhea, nausea, and vomiting, they haven't been treated. So, but I know you're right that if you get the treatment, you're gonna feel more nausea, etc., and gastrointestinal symptoms. It's just that the virus seems to be a little bit different. This is a virus that's mutating all the time, and similar to the flu, that you get to vaccinate every year to address it. In this case too, probably if a vaccine is out, maybe we're gonna have to get a new coronavirus every year vaccine, similar to the flu. We have H1N1 vaccines being made continuously, so maybe that's why the symptoms are a little bit different.
There's another question here. What is the actual risk with positive cases that don't show symptoms?
The actual risk of transmitting disease, of getting it? Well, it would depend on how many risk factors you have. So if you have asthma, if you have diabetes, for example, you have more high risk, even if you're young and strong, than another person your age that doesn't have those risk factors. And if you get exposed repetitively, probably that's a risk factor per se. So if you're a health professional and you're getting in your eye droplet from while you were intubating someone and doing procedures, probably that person is going to have a severe presentation eventually that wouldn't happen if that same person didn't get exposed in that repetitive way to the virus. Repetitive way.
Okay, here's another one. Bear with me. It had been a case that the person had the virus but never had the symptoms.
The person had the virus? Yes, 10% of all infected people, as per those countries that have been checking everyone in their population pretty much in Asia. Yeah, those numbers come from Asia. They're asymptomatic. 10%.
Okay. The next one here, what measures should a doctor take when coming back home to her family from the hospital?
Okay, so that person, we mentioned briefly, that person takes out the shoes before coming into the house, and ideally should have a jacket over his clothes, and that would be the exposed part, and then would take it out, leave the shoes out, and go straight to take a shower without kissing anyone, without hugging anyone. Should go take a shower, take the clothes and put them to the side, and then wash those clothes afterwards um, without different from the other clothes. So that person in the hospital is different. They should do other stuff, but at the house, that's the way they should do it.
Here's another one. Are babies in risk getting the virus?
They get the virus similar to adults. It's just that for the baby, they and infants, mortality and severity is so rare. In the case of those under nine and under, no one has died in that I know of in any of the countries. So they get just either no symptoms. Most of them are making that 10% of people that are asymptomatic, or very mild ones. So babies, they should be fine as long as they don't get a huge amount of exposure at once, but they should be fine.
Should all people get tested if they have traveled?
Yes.
But is it to specific
actually,
regions, David, or just any travel?
I would say maybe not so much testing, but should be in quarantine.
Yeah.
And isolation at the house. So testing is not that necessary, because eventually, since this is so infectious, most people are going to have it anyway. So at this point, testing is being prioritized to those that are having symptoms and could potentially develop severity, because you want to know, is this flu, mycoplasma, is this something else, or we need to treat like coronavirus. So this is testing at this point is more for the treatment strategy that you're gonna have. However, if you're having no symptoms and you have traveled recently, you should treat yourself as if you have it. So what you should do in your house, if you think you have been exposed to a friend, to someone that later on went positive, or you have been traveling, you should separate one of your rooms in your house and open a window. It should be a room that has enough ventilation, at least a window, and pretty much the person that has been exposed should stay in that room, and everyone in the house should bring the food to that place it in front of the door, and the person would take it and then close the door and stay isolated in that room and talk in terms of making an agenda when I'm gonna take a shower or something, so we don't have any contact at all, and just go take the shower and go back to the room. So that would be it, and the surfaces to be clean and disinfected.
We have more questions coming through.
Okay, go ahead.
How long the virus can last in clothes? Real quick.
How long?
How long the virus can last in clothes? Like
clothes,
clothes.
8 hours. 8 hours, similar to sidewalks, and that's why we leave the shoes out.
Okay. Is tiredness on and off a warning symptom or fatigue?
Yes, it's one of the symptoms. It's not the most common one, but after the other ones, it's up there. Yeah.
Is there any real-time tracking to know if the COVID is actually mutating?
Well, it is known that it's actually mutating. It is. At this point, some of the hypotheses why health professionals are having more severe symptoms, like 20% of health professionals are being having to be hospitalized, is because it could be had mutated and then the person got a second strain. However, at this point, none of the new strains that are being formed had so many changes that would infect to very badly a person after the first time. So the mutations that have been followed are not enough to infect.
Okay. So it is 3:15. I want to make sure that we finish this on time. I would like to thank David. Thank you so much for the time and for all the valuable information.